Hi, this is Jon Roffman, Managing Principal with ZS Associates. I'm here at ASCO 2016. I'm joined today by Dr. Debra Patt. Dr. Patt is a Vice President of Texas Oncology and also Medical Director of the U.S. Oncology Network. And today we're going to talk about value frameworks. So Dr. Patt, we've heard a lot of great innovations here at ASCO about some of the latest therapies. One of the big topics on people's mind is the cost of these therapies and the financial toxicity, which is a big buzzword that we're hearing about, how we're going to pay for these therapies. And so one of the tools that we've seen introduced over the past few years are value frameworks. ASCO has their value framework, the NCCN has their evidence blocks. There's a variety of these value tools that are being piloted, I would say. I'm curious to learn from you about Texas Oncology. How are you seeing these value frameworks applied to clinical practice?
So first of all, I'll say you're absolutely right. There's a great appetite to address value in cancer care. And I'll say that value has not been entirely resolved in oncology. I would say that there is discordance or disagreement in how value is measured between the different systems that measure value. Though everyone has the same idea in mind that value really is outcomes over cost, but really which outcomes over which cost, how much is worth it, and really for what period of time. I think those are all sort of important components. As you mentioned, there have been many different tools that people implement to try to assess value that have been incredibly useful. There are many leading organizations in the United States that have addressed this issue more systematically. So ASCO really has led the effort with the value framework. And this really looks at efficacy, toxicity, and cost as weighted determinations and thinking about therapeutic interventions for patient care. Actually, this effort began in 2015, or at least was first published in 2015, and they've just finished a one-year comment period. So they're now sort of tweaking the tool to make it more user-friendly, and then they've gotten a lot of feedback from patients that patient-reported outcomes instruments should be incorporated in that tool. So I think that there is consistency between organizations about efficacy, toxicity, and cost, and that a patient voice needs to be represented. In U.S. Oncology, in Texas Oncology, where I practice, while we don't routinely use those instruments to make value determinations, we do always evaluate value when we think about inclusion on our level 1 value pathways. And so that's how we really incorporate value and how we think about decision making. And so when we think about a drug for inclusion into pathways, one, we work in collaboration with NCCN, so we have to be concordant with NCCN guidelines. So first and foremost, it needs to be FDA approved and in accordance with NCCN guidelines. But then we look at efficacy, toxicity, and cost, looking at the incremental cost effectiveness in comparison to the next nearest comparator. I think what we'll see in the future is that many pathway systems and networks will have values assessments that they'll use and bring into the equation of how we think about therapeutic interventions for patients. We know that given CMMI's new guidelines that they'd like to see value-based pricing or a value-based mechanism to evaluate therapeutic interventions, that this is, they too have an appetite for this kind of determination. But I think the work that needs to be done is to get agreement upon exactly how we're going to move forward. I think everyone is in the right ballpark with the idea, but the devil, as it always is in the details. But I think actually CMS and CMMI's great interest in having a value-based prescribing serves as a great catalyst to get buy-in from different organizations like ASCO, like NCCN, like US Oncology, like VIA Pathways, or others that want to incorporate value in decision making to try to collaborate together and work with CMS to come up with acceptable tools for implementation of these kinds of programs.
And are these value tools changing the discussion between a physician and a patient?
I think that they could. I think that especially if you're using something like ASCO's Value Framework or NCCN's Evidence Blocks, that you could bring that up in a room with a patient. I'll say that the way we've incorporated it within the pathway system, it sort of happens before you even see your potential choices that we are trying to facilitate. So So in that way, I don't think it generally comes into the conversation, with some exceptions. And the some exceptions are when you prescribe very expensive drugs where patients have a high copay, and it serves as a barrier for them to get appropriate care. And in that way, sometimes value comes into the one doctor, one patient discussion.
Great. Well, thank you for your time.
Thank you.
And thank you, everybody. Goodbye from ASCO 2016.